You can invite Mariam Chanos to deliver the vote of thanks at the end of the webinar. Good evening, everyone, and welcome to the crucial webinar on child abuse. I am Joanne, the today's webinar. I am honored to be leading this important discussion today. Before we begin, I want to emphasize the severity of child abuse, its widespread issues, the devastating consequence of for victims, families, and communities. Let's approach this conversation with sensitivity and respect, recognition potential impact it may have on some participants. The season is designed to help everyone be aware about child abuse. Now, I would like to invite Ayisha Dhina to begin.
Can you see, ma'am?
Yeah, dear, we
Yeah.
can.
Yes.
Today my topic is child abuse.
Can you make it full screen, Aisha?
Yeah, ma'am.
Yeah, the top right. Sorry, the bottom right corner. Okay. Yeah.
Today my topic is child abuse. Introduction. Child abuse is when a parent or caregiver, whether through action or failing to act, causes injury, death, emotional harm, or risk of serious harm to child. There are many forms of child maltreatment, including neglect, physical abuse, sexual abuse, exploitation, and emotional abuse. Adults can experience a range of psychological, emotional, and social problems related to childhood abuse. Emotional abuse. The five types of abuse: emotional abuse, neglect, physical abuse, family violence, and sexual abuse. Emotional abuse refers to the psychological and social aspects of child abuse. It is the most common from a child abuse. Neglect. Neglect refers to a range of circumstances in which a parent or caregiver fails to adequately provide for child's needs. Physical. Through the provision of food, shelter, and clothing, by exercising adequate supervision of and control of the child, by ensuring their access to medical care when necessary, by ensuring that the child regularly attends school. Emotional, by providing them with care, love, and support. We showing appropriate moral and legal guidance. Causes of the neglect. Socioeconomic status, number of children, stress, psychological problem, drug and alcohol misuse, being abused or having been in care as children, strict behavior, unhappy, aggressive, weak, hungry, poor personal hygiene, physical abuse. Physical abuse. Physical abuse may be hitting, slapping, kicking, or striking with an object to children. This is the child abuse. What do you feel right now? Family violence. Family violence or domestic violence usually refers to the physical assault of children and women by male relatives, usually a father, husband, or partner. In these situations, a man uses violence to control his partner and children, often in the belief that violence is a male prerogative or that his victims are responsible for his behavior. Signs of childhood. A child witnessing family violence and domestic violence is at risk of behavioral and emotional difficulties, learning difficulties, long term development problems. Sexual abuse describes any incident in an adult engages a minor in a sexual act or exposes the minor to inappropriate sexual behavior or material. Sexual abuse also describes any incident in which a child is coerced into sexual activity by another child. A person may sexually abuse a child using threats and physical force, but sexual abuse often involves subtle forms of manipulation in which the child is coerced into believing that the activity is an expression of love, or that the child brought the abuse upon themselves. Sexual abuse involves contact and non-contact offenses. Physical care. Abuse victims often require physical nursing care. In this emergency room, this may include cleaning wounds or applying a dressing. If injuries are severe, the patients may need surgery and nursing care during the convalescent period. The nurse might provide medications for pain or helping the patient learn to walk with crutches. In addiction, victims of abuse may need education for self-management if they have injuries that will take some time to heal, such as broken bones. Emotional support. The empathetic nurse can help provide emotional support by listening and allowing patients to express whatever they feel. Children may respond to the gift of a stuffed toy to which they can confide all the bad things that have happened to them. The older adults may be ashamed to admit that her children are abusing her. Nurses offer an opportunity to talk about feelings and may also be able to suggest a referral to a counselor who is experienced in dealing with abuse victims. Prevention. Recognizing the potential for child abuse and the seeking or offering of intervention, counseling, and training in good parenting skills before battered child syndrome occurs is the best way to prevent abuse. The use of educational programs to teach caregivers good parenting skills and to be aware of abusive behaviors so that they seek help for abusive tendencies is critical to stopping abuse. Support from the extended family, friends, clergy, or other supportive persons or groups may also be effective in preventing abuse. Signs that physical abuse may occur include parental or alcohol or substance abuse, high stress factors in the family life, previous abuse of the child or the child's siblings, history of mental or emotional problems in parents, parents abused as children, absence of visible parental love or concern for the child, and neglect of the child's hygiene. Thank you.
Okay, Dhina. So it's over, the presentation, right?
Yeah.
Any questions? So now it's time for the question answer. Okay, dear?
I have a question. I don't know, but yeah, like, how would child abuse affect us? Hello.
Yes, Dhina, you can answer to Russell's question.
One moment. Can't get- I can't take. Yes, ma'am.
So the question is, how would child abuse affect us?
It affects our body. Of it will make us heal. Mm,
It's okay if you don't know the answer. I have another question.
Yeah, wait, Russell, wait. Dhina, you can answer it in your own words, my dear. Just tell what you know, it's okay.
like I show some photos of the
Yeah, I know.
yeah.
Oh, okay, yeah. So my second question is why did people start to do child abuse?
Because especially like the smaller babies it is a,
Oh,
if
okay.
Uh, can I ask?
Yes, yes, Zohar.
So, how prevalent is child abuse in society today? Did you get my question?
no, I don't understand.
How prevalent, how prevalent is child abuse in society today?
Ma'am, I didn't understand the question.
Yeah, Zohar, can you explain it little more? Like she's
Ma'am,
asking how common is it very common nowadays? She's asking like that.
Yeah, in this time, mostly the small babies are experiencing like this child abuse nowadays in social. So that mm, it is very common nowadays.
yeah, okay. Thank you.
Yes, Ihan.
So what are the abuses? As I show in the presentation, like neglect, emotional abuse, physical abuse, like that abuses are there. Okay, then. Family violence. Mm, yeah. Yeah, ma'am.
Okay,
Yeah,
any more
there is
questions?
still
Dina, if you want, you can call out anyone from the participant list and you can ask a question to them. Do you want to?
No, I don't have any question.
Okay. So, any more questions, children? Those who have joined?
No, I don't have any question.
Okay. Abigail, Fatima answer.
Can I just ask a question?
Yes, please.
Yeah, yes.
So my question is why most people do child abuse?
Can you speak a little more clear?
Like, can you tell why people do child abuse?
Why people do child abuse? That's your question, right?
Like, it's not it's like my own answer. If they like that, I don't know.
Okay. Anything else, my dear? You want to add something? Okay. Any more questions?
Yeah.
Okay.
Yes, we can wind up, right, ma'am? No
Yeah.
more
So,
questions.
Johan, you can continue, Johan. Please continue the anchoring. You can invite for the vote of thanks.
I would like to invite Mariam Chanas to deliver the vote of thanks.
A big thank you to Johan for his capacity, passionate lighting presentation. Present.
Yes, Mariam. Mariam? Okay. So, Dina, it was a very nice presentation. Okay, dear, very informative.
Thank you.
Yeah. And thank you, Johan, for anchoring and the welcome speech, and Mariam for the vote of thanks. Thank you all
Welcome.
for attending this webinar. Thank you so much. You all can leave now, okay?
Bye.
Have a nice day, all. Bye.
Bye, ma'am.
Bye, ma'am.